In the sterile, unforgiving halls of Mercy General Hospital, silence was a luxury, and weakness was blood in the water. To the arrogant residents and the ambitious chief of trauma, Mattie Jensen was just the cripple, a middle-aged nurse with a heavy limp and a thick file of orthopedic shoes. They mocked her slow gait. They laughed at her silence. They tried to force her out, but they didn't know that the leg she dragged wasn't injured in a car accident or a fall. It was shattered in a valley in Kandahar while she was keeping their heroes alive. They were about to learn that you never judge a warrior by their scars. The sound was distinct. It wasn't the squeak of rubber soles on polished linoleum, nor was it the sharp clack of high heels. It was a rhythmic, uneven cadence that echoed through the trauma wing of Mercy General. Step, drag, step, drag. Mattie Jensen didn't look up as she pushed the medication cart down the hallway. She kept her eyes focused on the charts, her face a mask of practiced neutrality. She was 42, though the lines around her eyes and the silver threading through her dark hair made her look older. She wore her scrubs loose, and her left leg was encased in a thick, supportive brace that disappeared into a heavy black orthopedic boot. "Here comes Hopalong," a voice whispered from the nurse's station. Mattie heard it. She always heard it. But she didn't flint. She simply checked the dosage for the patient in room 304, a young man recovering from a motorcycle accident. "Be nice, Jessica," another voice chuckled, though there was no kindness in the tone. It was Dr. Brock Sterling, the newly appointed chief of trauma. He was young, brilliant, and possessed an ego that barely fit through the double doors of the emergency room. "She moves at her own pace. We can't all be built for speed." Whoa. "Speed saves lives, Doctor." "Jessica," the head charge nurse replied with a simpering smile, twirling a pen. "I'm just saying if there's a code blue at the other end of the ward, by the time Mattie gets there, the patient will be collecting a pension." Laughter rippled through the station. Mattie tightened her grip on the cart handle until her knuckles turned white, but she didn't stop. She turned into room 304, leaving the cruelty behind her. Inside the patient, a 19-year-old named Toby looked up. He was in pain, his leg elevated in traction. "You okay, Mattie?" Toby asked. He was one of the few who liked her. She was gentle with his dressing changes, and she knew exactly how to position pillows to relieve the pressure on his fractured femur without him having to ask. "I'm fine, Toby," Mattie said, her voice raspy, as if she didn't use it enough. "Time for your antibiotics. How's the pain scale?" "It's a 6, but it's better when you're on shift. The others, they just rush." "Rushing leads to mistakes," Mattie murmured, injecting the medication into his IV port. Her hands, unlike her legs, were steady. Rock steady. There was a precision to her movements that was almost mechanical. No wasted energy. Every motion had a purpose. As she worked, the intercom crackled. "Dr. Sterling to Trauma 1. Dr. Sterling to Trauma 1. Multiple GSWs inbound." GSWs. Gunshot wounds. Mattie finished with Toby and stepped back out into the hallway. The energy in the ER had shifted. Controlled chaos was descending. Dr. Sterling was barking orders, his white coat flying behind him as he strode toward the ambulance bay. Jessica was right on his heels, clipboard in hand. "Jensen," Sterling shouted without looking back. "We need hands. Get to Trauma 2 and try to get there before the patient bleeds out, will you?" Mattie didn't respond. She just moved. She shifted her weight, ignoring the grinding ache in her left femur, a souvenir from a jagged ridge in the Peck Valley, and forced her body into a faster rhythm. The limp became more pronounced, a violent lurch with every step. But she closed the distance. Trauma 2 was a mess. The patient was a victim of a drive-by shooting a male in his 30s with a bullet wound to the upper thigh. Arterial bleed. "Get pressure on that femoral." "Dr. Reynolds!" A second-year resident yelled, looking panicked. The blood was spurting in a high arc, coating the floor. Mattie was there instantly. She didn't wait for gloves. She grabbed a stack of trauma pads and leaned her entire body weight onto the man's groin, finding the pressure point with an instinct that bypassed conscious thought. "I need a tourniquet," Mattie said. Her voice wasn't loud, but it cut through the noise like a knife. "High and tight. Now." "We need to clamp it," Reynolds argued, fumbling with instruments. "You can't see the bleeder, doctor. Apply the tourniquet, or he dies in 30 seconds, Mattie commanded. Her eyes were coal-dark tunnels. Reynolds hesitated, stunned by the authority coming from the crippled nurse. But he saw the blood pooling. He grabbed the cat tourniquet and cinched it down where Mattie indicated. The bleeding slowed, then stopped. "Good," Mattie said, finally grabbing gloves from the wall dispenser with one hand while keeping pressure with the other. "Now get a line in. 2 large bore IVs, 18 gauge. He's going into shock." Just then, Dr. Sterling walked in, having stabilized his patient in trauma 1. He looked at the blood on the floor, then at Mattie. "Jensen, why aren't you scrubbed in properly?" Sterling snapped, seeing her bloody bare hands. "This is a sterile environment, not a butcher shop." "He was spraying arterial blood, doctor," Mattie said calmly, stepping back as the nurses took over the IVs. "Sterility doesn't matter to a corpse." Sterling's jaw tightened. He hated being corrected, especially by her. "Go get cleaned up." "Så I syns han Jensen." "Next time, follow protocol. If you infect my patient because you were too slow to put on gloves, I'll have your license." Mattie looked at him. For a split second, a flash of something dangerous appeared in her eyes, a look that had stared down things far more terrifying than an arrogant Ivy League doctor. But she blinked, and it was gone. "Yes, doctor," she said softly. She turned and limped away, the click-drag of her boot marking her retreat. The break room was empty, save for the humming of the refrigerator and the smell of stale coffee. Mattie sat on a plastic chair, her left leg extended straight out in front of her. She unstrapped the top Velcro of her heavy boot to relieve the pressure. The skin beneath her scrub pant was a map of scar tissue, purple and jagged, twisting around the metal rod that had replaced her shattered bone. She closed her eyes and took a deep breath. The sound of the rotor blades, the smell of burning diesel and copper, the scream of "Medic, we need a medic!" echoing off the canyon walls. Rough shift. Mattie snapped her eyes open. It was Dr. Holloway, the older anesthesiologist. He was a kind man, nearing retirement, and the only other person in the hospital who treated her with genuine respect. "Just the usual," Mattie said, refastening her boot quickly. She didn't like people seeing her vulnerability. "Sterling is riding you hard," Holloway observed, pouring himself a coffee. "He's a good surgeon, technically speaking, but he lacks perspective." "He's young," Mattie dismissed. "He thinks medicine is about being the smartest person in the room." "And you?" Holloway asked, leaning against the counter. "You never talk about where you learned to apply a tourniquet like that. I saw the footage from the camera in Trauma 2. That wasn't nursing school training, Mattie. That was muscle memory." Mattie stood up, testing her weight. "I worked in a busy ER in Chicago before this. You see a lot of things." It was the lie she always told. It was close enough to the truth to be believable, but vague enough to stop questions. She couldn't tell him the truth. She couldn't tell him that she had been a lieutenant in the Navy Nurse Corps, attached to a cultural support team that ran alongside SEALs and Rangers. She couldn't tell him that muscle memory came from trying to patch up boys who had been blown apart by IEDs in the dirt while taking fire from the ridges. That life was over. She had been medically discharged with a purple heart and a shattered leg that would never truly heal. Now she just wanted to do her job and go home to her empty apartment. She walked back out to the floor. The shift was dragging on. It was 2:00 a.m., the graveyard hour, where the city's worst nightmares usually rolled through the doors. Jessica was at the station whispering to a group of interns. As Matty approached, they fell silent, smirking. "Oh, look, she's back," Jessica said, loud enough to be heard. "Did you take a nap, Matty? We know it takes you a while to get moving." "Is the inventory done for the crash carts?" Matty asked, ignoring the jab. "I assigned that to you," Jessica said innocently. "Since you can't exactly run to codes, I figured you could handle the paperwork and stocking, better suited for your abilities." It was a demotion. Stocking crash carts was work for a first-year student, not a veteran nurse. "Fine," Matty said. She took the clipboard. She spent the next 3 hours systematically checking every crash cart in the ER. She was thorough. She checked expiration dates on epinephrine, ensured the laryngoscope blades had working batteries, and organized the drawers with obsessive precision. As she was finishing the cart near the ambulance bay, the red phone at the charge desk rang. It was the direct line from emergency dispatch. Jessica answered it, looking bored, but within seconds her face went pale. She stood up straight. "Say again." "How many?" Dr. Sterling was walking by, scrolling on his tablet. He stopped when he saw Jessica's face. "What is it?" Jessica hung up the phone. Her hands were shaking slightly. "Mass casualty event. A charter bus overturned on the interstate. Multiple critical injuries. They're estimating 30 victims. First transport is 5 minutes out." Sterling's arrogance vanished, replaced by the adrenaline of command. "All right, people. Listen up. We have a mass CAL inbound. Clear the trauma bays. I want every available nurse and doctor on the floor. Page the on-call surgeons. Move." The ER exploded into action. People were running, shouting orders, grabbing gurneys. Matty stood by the crash cart she had just stocked. She watched the panic rising in the eyes of the younger nurses. She saw Reynolds hyperventilating near the sink. "Matty!" Sterling shouted across the room. "Don't just stand there. We need space. Go move the non-criticals to the waiting room. Get them out of the beds." It was grunt work, ushering people out. But Matty nodded. "On it." She began moving patients, her limp heavy, but her pace relentless. She cleared 4 beds in 3 minutes. Then the doors burst open. The first wave of paramedics rushed in. Male 50s, crushing chest injury. Female 20s, open fracture, head trauma. The noise was deafening. Screams of pain, the beeping of monitors, the shouting of doctors. Matty was helping an elderly woman into a wheelchair when she saw it. A paramedic team was wheeling in a stretcher, looking frantic. On the bed was a young girl, maybe 7 years old. She was grey, limp, and covered in blood. "We lost a pulse," the medic screamed. "She's coding. We need a room." Trauma. "One is full," Jessica shouted back, looking overwhelmed. "Trauma 2 is full. Put her in the hallway." "Doctor." Sterling was deep in a chest cavity in Trauma 1. There were no doctors available. The medics slammed the brakes on the stretcher in the middle of the hallway. One of them jumped up to start compressions. Matty looked around. No residents, no attendings. They were all swamped. The little girl was going to die in a hallway because of a lack of hands. Matty abandoned the wheelchair. She didn't limp this time. She surged forward, ignoring the fire shooting up her leg. She reached the stretcher. "Stop compressions, check rhythm," Matty barked. The medic looked at her. "Who are you?" "I'm the one saving this girl," Matty growled. She looked at the monitor. Ventricular fibrillation. Shock her. 4 joules per kilo. Charge to 100. "We need a doctor to authorize." "I said charge it," Matty roared. It was the voice of a commander, the voice that had ordered Marines into cover. The medic charged the paddles. "Clear." Thump. The girl's body arched. "Resume compressions," Matty ordered. She grabbed the ambubag. "I need an airway. She's not moving air." She tilted the girl's head. The throat was swollen, crushed by the seatbelt. "Airway is compromised. I can't intubate. We need a surgical airway." "Where is the doctor?" the medic yelled, looking around. Matty looked at Trauma 1. Sterling was yelling about a bleeder. He wasn't coming. "Hand me a scalpel," Matty said. "You're a nurse." Jessica appeared at her elbow, eyes wide. "You cannot perform a cricothyrotomy. It's illegal. You'll go to jail." "She has 2 minutes before brain death," Matty said, her hand held out. "Give me the damn scalpel, Jessica." "No, I won't be a party to this." Jessica backed away. Matty didn't hesitate. She reached into the trauma bag on the stretcher, ripped open a sterile kit, and grabbed a 10-blade. "Hold her head," Matty told the medic. With steady hands, Matty palpated the small neck, finding the cricothyroid membrane. It was difficult on a child, nearly impossible in a chaotic hallway. But Matty had done this in the back of a Black Hawk helicopter in turbulence. She made the incision. Blood welled up. She ignored it, feeling for the opening. She inserted the tube. "Bag her," Matty said. The medic squeezed the bag. The little girl's chest rose. "We have a pulse," the medic shouted. "Sinus rhythm returning. Sats are coming up." Matty exhaled, her shoulders slumping slightly. She taped the tube in place. Suddenly, a hand grabbed her shoulder and spun her around. It was Dr. Sterling. He had blood on his gown and fury in his eyes. "What do you think you are doing?" Sterling hissed, looking at the scalpel in her hand and the tube in the girl's neck. "Did you just cut into a patient without a physician present?" She was coding. Airway was crushed. Matty said, her voice flat. "She's alive." "I don't care," Sterling shouted loud enough for the entire hallway to hear. The chaos momentarily paused. "You are a nurse. You are not a surgeon. You are a liability with a bad leg who just committed malpractice. Get out of my ER." "Doctor, she saved her." The medic tried to interject. "Get out." Sterling pointed to the exit doors. "You're suspended pending an investigation. Go home, Jensen. Before I have security throw you out." Matty looked at him.